Yes, ma'am.
Yes. So what we studied yesterday, we studied nervous system, its parts, and one disease which was multiple sclerosis. So what type of order was there in multiple sclerosis? Ascending or descending?
Descending.
Yes. And
Ascending.
what was affected in multiple sclerosis? Myelin sheet was present or absent?
Absence of myelin sheath.
And what
Absent.
was found in the MRI findings?
Down
fingers.
Yes. And what about the medications? One teaching.
The steroids
Do
were
not drive.
that is
When taking this,
First was like you do not have to stop the medication abruptly. And the second one was do not drive when you are taking cyclobenz. What? Benzaprine.
yes.
Okay. And what about the steroids? I told you that's really important.
hypokalemia,
hyperglycemia, edema,
Hypernatremia, edema, hyperkalemia,
hypokalemia,
hyperkalemia,
hypocalcemia.
hypovolemia, hyperglycemia, hypocalcemia.
So, Kawaljeet, please turn on your camera. Okay, so today we will be learning about meningitis. So yesterday I told you what is the meaning of itis.
Inflammation.
Itis means
Inflammation of the brain and
inflammation.
the brain.
And what was the meaning of this? Meninges.
Inflammation in the covering layer of the brain.
Yes, very good. So now we will study about meningitis. Okay. Keep your pen and notebook with you. So the first thing about meningitis is you need to take droplet precautions. So what is the meaning of droplet precautions? What we have to do in droplet precautions? In droplet precautions, you have to keep one thing in mind, that you need to wear which mask?
surgical mask.
No other mask. Whenever there will be droplet precaution, whenever you will be getting this term droplet, that means which mask will be used?
Surgical mask.
Surgical mask. Keep this in mind. This is very important. Okay. Then there is increased ICP. What is the full form of ICP? Any idea?
Intracranial pressure.
Yes. ICP means intracranial pressure. Okay. Now, one thing happens whenever there is ICP. Anyone, you have any idea what happens when there is increased ICP?
Edema of the brain.
You need to keep this thing in mind. Whenever there is increased ICP, the vomiting will be projectile.
Good evening, ma'am. Sorry for delay.
It's okay. You can continue. We have just started the lecture. Our lecture is about meningitis. In meningitis, there is inflammation of meninges and there is droplet precautions. In droplet precautions, you need to use surgical mask. Surgical mask is very important in droplet precautions. The second thing which happens in meningitis is increased intracranial pressure. So whenever there is increased intracranial pressure, there will be projectile vomiting. Okay. So if there is one patient who came to you and coincidentally he vomited in front of you only. So if the vomiting is projectile, what you will you will think that the patient is having meningitis. It is one of the symptoms of meningitis. Then
blurred vision, neck stiffness.
There will be tachycardia. difficulty in speech, sun setting eye. I will show you picture of this thing, sun setting eye, then you will get to know more clearly.
Yeah, stiffness.
No,
Stiffness of neck.
that we will study. First, you need to write these things. We will
Okay.
study in order. Then there will be joint pain, fatigue, seizures, headache. Have you written?
Yes.
Yes, ma'am.
Yes, ma'am.
Then there will be light sensitivity.
Photophobia. No.
Yes.
Photosensitivity.
Also known as photophobia. Correct. So what all will be there? Yes.
Projected vomiting, tachycardia,
Difficulty in
sunsetting eye,
Blurring of speech,
Slurred speech.
sunset
Sunsetting eye.
joint pain,
Now tell me one thing.
fatigue, headache.
Yes. If there is inflammation, what one thing should be there?
fever.
Why?
Yeah, fever.
High
Because
fever.
the reason
Fever.
being because it could be because of any bacterial causes. Meningitis
Yeah.
can occur because of any bacterial, any viral, any fungal, any parasite. There are various causes of meningitis. Okay, there will be fever, and the one which you guys were talking about,
Neck rigidity.
then there will be stupor. Now, if there is increased written till now,
Yes, ma'am.
so whenever there is increased ICP increase means your intracranial pressure has been increased. Your intracranial pressure has been increased. So it will also lead to papillary edema. Anyone who knows the idea of what is papillary edema?
Swelling.
Papillary edema means your optic disc, there is swelling of your optic disc. Then mutual rigidity means there is stiffness in the back of the neck. There is stiffness in the neck. Then there are two main important signs in meningitis. Two main important signs in meningitis. Kerning sign
Drooling sign.
and
Rosalind sign.
Rudzinski's sign. Kernig's sign and these are physical exam findings. You can find these two signs in physical examination. So what happens in Kernig sign is, I will first tell you about Kernig sign. So in kerning sign, if there is this patient, okay, spare my diagram, okay, don't focus on my diagram. You can make your own man or whatsoever you want to make, okay. So if this is the person, he is lying down, okay, and you are asking the person to extend his knee. So whenever you will lift his leg and extend his knee, there will be pain. This knee cannot be extended fully. You can memorize kerning sign by one thing. K for kerning, K for knee. You won't get confused in kernings and Brzezinski's. Okay, K for kerning, K for knee. In kerning sign, the knee cannot be fully extended, whereas in the other one, if the person is lying down and you are instructing the person, to flex his neck. So when the person will flex his neck, it will automatically lead to the flexion of knee. Flexing of neck will lead to flexion of knee. This will happen in Brzezinski's sign. Any confusion in these two signs? Any confusion? Are you guys
Yes,
clear
ma'am.
with these two signs, because they are very important and students get confused? Okay.
Good evening, ma'am.
Good evening. So this was about Kerning's and Brzezinski's sign. Okay. So now, as we have learned about symptoms, but there is one thing which you need to keep in mind. Triad of meningitis. Triad of meningitis is fever, headache, and rigidity. You need to keep this thing in mind.
Fever, headache, rigidity.
Yes, these are known as the triad of meningitis. Any doubt?
No, ma'am.
So there is one way of diagnosis of this disease. How can we diagnose if the disease is meningitis or not? Via lumbar puncture. It is done at L3, L5, and the position of the patient is lateral decubitus. You need to keep this in mind. So now I will give you some key points related to this lumbar puncture, which are very important. Lumbar, LP means lumbar puncture, okay? LP means lumbar puncture. So in which space lumbar puncture is done? It is done in subarachnoid space. First thing. Then this procedure is sterile procedure. Second thing to keep in mind. Third thing is you need to instruct the patient to void before the procedure. You need to instruct the patient to void before the procedure. Now, one thing. At the time of lumbar puncture, we used to give the position lateral decubitus. But after the lumbar puncture, you need to give the position supine. This you need to highlight. This one. At the time of lumbar puncture, you will give the position lateral decubitus. But after lumbar puncture, you will give the position. Which position you will be giving? Supine. Okay. Keep this in mind. Okay. Few more things which you need to keep is after lumbar puncture, you need to instruct the patient to increase the fluid. You need to increase the fluid of the patient. You need to increase the fluid of the patient. But there are few contraindications. What is the meaning of contraindications? Contraindications का मतलब है वो कुछ conditions जहां पर आप lumbar puncture perform नहीं कर सकते.
Avoid.
Yeah, you cannot perform lumbar puncture in these conditions. And those conditions are increased ICP, increased INR, decreased platelet, then chronic back pain, one more thing is that you need to stop NSAIDs of the patient before lumbar puncture. So, in question, in exam, if there are questions related to lumbar puncture, those are from these things only. Okay, what you need to stop before lumbar puncture?
NSAIDs.
Yes. And then what is the position before or during the procedure?
Before we give lateral decubitus and after supine position.
After spine position.
One more which you will instruct the patient will be?
Increase the fluid.
Yes, you need to increase the fluid.
Fluids.
Okay, and these are the contraindications which you need to keep in mind. You can write this down.
Yes, ma'am.
INR.
ICP, INR, platelet, chronic back pain.
Yeah, but you need to note down the arrow as well as upward means increase and downward means decrease. Upward means increase and downward means decrease.
INR, international normalized ratio, is it?
Yes. Any questions, any doubt till now?
No, ma'am.
Shall we continue?
Ma'am.
Yes,
Okay.
ma'am.
Yes, ma'am.
Now the treatment part.
Yes.
Please mute yourself. Ceftriaxone, vancomycin, acyclovir, plus dexamethasone. Dexamethasone is a steroid. Now it's your turn. What does steroid do to one's body? Steroid हमारी बॉडी में क्या क्या करते हैं जो मैंने कल आपको लिखवाया था?
मैम ये शुगर को वो करते हैं, इंक्रीज कर देते हैं.
Hyperglycemia.
Hyperglycemia,
Hyperglycemia.
edema,
But there is one thing.
hyperolemia.
Now हम steroids को फिर इसमें क्यों दे रहे हैं? Why we are giving steroids in meningitis? The reason being, it will decrease cerebral edema. It will decrease cerebral edema and increase permeability of antibiotics to blood-brain barrier. So this is the reason why we are administering this dexamethasone, which is a steroid, to meningitis patient. And one more thing you can give is hip vaccine. This vaccine can also be administered. Now there are few nursing interventions which you need to keep in mind based on your NCLEX. Now, if there is patient of meningitis assigned to you, you need to keep these things in mind. First is decrease stimuli. Because what is the reason of decrease of stimulus? May I know the reason? Yes, anyone? As we have studied in the symptoms that the patient will be photophobia. In meningitis, there are symptoms of photophobia. So we will decrease the stimulus. Then the head of bed should be 30° only. You need to monitor intracranial pressure. For which, उसके लिए आप क्या कर सकते हो? आपको अवॉइड करना है पेशेंट को कफ ना हो और पेशेंट जोर से स्नीज ना करे, बिकॉज कफिंग और स्नीजिंग से हमारे ब्रेन का जो आईसीपी होता है वो बढ़ जाता है. उसके बाद हमने देखा था कि सिम्टम्स में सीजर्स भी थे. अब अगर सीजर्स के सिम्टम्स हैं तो हम सीजर्स के प्रिकॉशंस भी ले सकते हैं या नहीं ले सकते?
Yes, ma'am.
We can take the precautions, seizure precautions. Then हमने देखा था कि अगर लंबर पंक्चर हो रहा है, then we need to increase the fluid level. तो हमारा एक और क्या रिस्पॉन्सिबिलिटी आ गई कि हमें जो
फ्लूइड लेवल इंक्रीज करना है.
तो ये जो है ये आपके पार्ट में चीजें आती हैं. These all things and these are very important. Any doubt? Yes. Any doubt? Any query till now?
There's ki-
Yes, रोजली क्या कह रहे हैं आप?
पेशेंट को सेडेशन वगैरह कुछ नहीं देंगे?
Shashikala, you are not audible. What you are trying to say?
No, ma'am.
Okay. Then Rosaline. Yes, Rosaline. No doubt. Fine. So let's give a quick recap of this meningitis. So first thing was meningitis में हमें कौन से precautions लेने हैं बताइए.
सर्जिकल मास्क.
Yes. और उसमें क्या क्या हो सकता है. मेनिंजाइटिस में जो आपका इंट्राक्रेनियल प्रेशर होगा वो बढ़ेगा या कम होगा.
बढ़ेगा.
होगा मैम.
अब अगर इंट्राक्रेनियल प्रेशर बढ़ेगा तो क्या होगी. प्रोजेक्टाइल वॉमिटिंग. प्रोजेक्टाइल वॉमिटिंग होगी और क्या हो सकता है. टेकिकार्डिया हो सकता है. स्लर्ड स्पीच.
Sunsetting eye,
Sunsetting eye,
joint
joint
pain,
pain,
fatigue.
Fatigue,
headache,
seizure, headache, light sensitivity,
light sensitivity,
fever,
photophobia,
fever, neck rigidity,
Yes, yes,
inflammation.
yes,
Inflammation
stiffness.
होगी तो fever होगा because due to parasites or bacteria.
yes, good.
Swelling.
And one thing you need to keep in mind is this also. Intracranial pressure is also lead to papillary.
Papillary.
Okay.
Yes,
Then
ma'am.
next,
Mutual rigidity
these two signs, Kerning sign and
and
Brusselton sign.
bruising sign.
These are important signs. Okay. Then next was
Triad of meningitis.
Kerning sign.
Yeah.
What was the
Curving
problem?
signs.
Knee pain.
Yeah,
Difficulty
cannot
to
be-
extend knee.
Yes, there was difficulty.
fully.
Yes, and in Brunken sign, whenever you will flex the neck, whenever
It
the
sleeps.
and no,
It
then
automatically
leads
flexion
to
of knee.
Flexion
Yes.
of the knee.
very good. The next is triad of meningitis,
Meningitis.
which is fever.
Fever,
Headache.
headache,
fever, headache,
rigidity.
Yes. Then what was the next thing? Lumbar
Diagnosis.
Lumbar puncture.
The 3 and 4.
L3, L4.
Position lateral
Position of the
decubitus.
patient.
Was
Lateral
at the
decubital.
time of procedure. Later, what was the position?
Lateral.
Supine position. After the procedure,
Yes, supine.
and this procedure is,
Sterile procedure.
Sterile
Yes.
procedure.
and the space is subarachnoid.
subarachnoid space.
Subarachnoid space.
Subarachnoid.
One more thing which you will instruct the patient is to void before.
Void before the procedure.
Very
Before
good.
procedure.
Hmm. And then there are few nursing interventions such as decrease in stimuli. Head of bed will be,
30 degrees.
30 degrees.
you need to monitor ICP. How you will monitor ICP?
Avoid coughing and
Avoid
Avoid
coughing and
coughing,
sneezing.
sneezing.
Seizure precautions and
Increase fluid levels.
And increase the fluid level.
very good. You all were attentive in the class. Now I will tell you few signs. I will show you the sign of, wait a second, I will show you that sun setting sign. So this is sun setting sign. You guys are able to have a view?
Yes, ma'am.
So this is known as sun setting sign. इसको हम कहते हैं sun setting sign. You need to keep this in mind. Okay? So
Yes,
now
ma'am.
tell me any doubt, any query in meningitis topic. Yes. Any doubt? Quick recap करो जल्दी से देखो कोई डाउट है तो बताओ then we will switch to next topic.
मैम जरा ये स्टार्ट के साइन बता दें. मैंने
क्या
क्लास
बताना
में
है?
join-
क्या पूछ रहे हो आप?
मतलब ये स्टार्ट में मैडम जो साइन आपने बताई।
आप मुझे ना यू कैन टाइप इन द चैट, मुझे आपकी आवाज क्लियर नहीं आ रही, व्हाट यू आर ट्राइंग टू आस्क।
ओके मैम।
You all can switch on your camera. Please turn on. देखो मे बी आप लिख रहे हो what you are doing, या मैं सिर्फ बोल रही हूँ, whether you are engaged in the class. Okay, good, good. That means you all are writing. Okay, fine. Yes. You have such beautiful faces. Please turn on your cameras. आप क्यों छुपा रहे हो? Yes, Rosaline. So your question was sign. Okay, we will have a quick recap. चलो अब सब आप हम Rosaline को बताएंगे what were the signs we discussed. बताइए क्या क्या साइन हमने डिस्कस किए थे मेनिंजाइटिस के? इंक्रीज्ड
ICP,
देन सनसेटिंग साइन,
sunsetting
Headache.
light,
हेडेक, देन फीवर,
tachycardia,
यस फीवर एंड
fatigue, seizures,
सीजर्स,
light sensitivity,
photosensitivity, then rigidity
photophobia,
of the neck is known as
Bridging
bruising
sign
signs,
and confusion.
rigidity of the neck,
rigidity,
rigidity of the neck.
Natural
mutual,
rigidity.
Yes, no,
Natural
yes,
rigidity.
yes. Then what all we had learned? Joint pain. Joint pain will also be there. Then papilledema.
inflammation,
In papilledema, what will be there? There will be swelling of what?
Swelling.
Swelling of the optic disc.
What is optic disc?
optic disc,
What is optic disc? Optic disc. Optic का meaning क्या होता है?
eye,
Eyes.
Eye,
Related to
तो
eyes.
swelling, तो swelling कहाँ होगी?
eyes,
eyes,
Surrounding.
outer
Yeah. Okay.
area of eye.
Then what all we had? Fatigue. Okay,
Stupor.
Rosaline. So these were the signs which we had studied. Any doubt, Rosaline, till now? Yes, Rosaline.
मैम क्लियर हो गई।
Clear?
जी मैम, थैंक यू।
Let's start. One second.
you are in mute, ma'am.
I'm sorry. Okay. So now we will learn about ICP. What is ICP? Kawalji,
Intracranial pressure.
No, no.
Intracranial pressure, ma'am.
Yes. जिसको मैं पूछूंगी आप वो बताना है, ठीक है? Now I know you all are attentive. Okay. Now let's check it. अब you can answer. अब कोई भी बता सकते हैं. Do you know what is the normal ICP? Normal level of ICP क्या होता है?
It's 15 to 30.
It is 5 to 15. 5 to 15. This is the normal ICP. You need to keep this in mind. Normal ICP is 5 to 15. Now tell me one thing. Rupa? Yes, Rupa. Please unmute yourself.
Yes, ma'am.
रूपा आप बताइए. Now tell me, अगर 5 से कम हो और 15 से ज्यादा हो, इन दोनों कंडीशंस में से नॉर्मल कौन सी है?
Can you ask in English, ma'am?
Sure. Now tell me, if the level is less than 5 and more than 15, is it normal?
No, ma'am.
No,
Why?
ma'am.
Why?
It is not in normal range. If it is less than 5, it is less ICP.
So if it is more than 15, it is increased ICP. If it is less than 5, it is decreased ICP.
This is the
So
ICP.
now we have learned, like, if there is anything which is not normal, then it do have some impact on our body.
Yes, ma'am.
Yes, ma'am.
मैम
What is the meaning of this term? What is the meaning of this term? किसी ने पहले, have you ever heard about this term? What is this term?
Something high. I don't know what is Caribbean.
Something what? Yes,
Very
yes.
common parlance.
Hypo auditor.
High excess level of carbon dioxide.
Now it's okay. ये किसने बोला था excess level of carbon dioxide? बताओ बताओ, जिसने भी बोला था सही बोला था. You were right. डरो मत. It is increased level of carbon dioxide, which means जब भी हमारी बॉडी में कार्बन डाइऑक्साइड का लेवल बढ़ जाएगा तो जो हमारा आईसीपी होगा वो क्या होगा? क्या होगा?
मैम इंग्लिश मैम.
Increase हो जाएगा मैम.
Whenever there is increased level of carbon dioxide, your intracranial pressure will increase. You have to keep this in mind. Okay, it will increase. Then there are few other causes of increased ICP. You can write it down. Oral or tracheal suction, extreme flexion or extension of neck. Then if there is extreme bending, increased abdominal pressure, all these things can contribute to increased ICP. Okay? And in increase of abdominal pressure, such as constipation. Have you heard about Valsalva maneuver?
Yes, ma'am.
In that condition also, our intracranial pressure increases, and one more cause can be their tight clothes. Tight clothes. So now tell me one thing. From these causes, you know intracranial pressure is gonna increase. Now I have one question for you all. Okay, a patient came to you. He was having increased intracranial pressure. He vomited in front of you. Okay, so if the vomiting is of what type, you will think that it is increased intracranial pressure. What will be the nature of vomiting?
Projectile vomiting.
Projectile vomiting.
The vomiting will be projectile. Now, from these causes which I have mentioned, what all things you can rule out at that particular time? You can watch if the person is wearing very tight clothes. Can you do that thing at that particular moment on the spot?
Yes, ma'am.
These are few things which you can judge on the very first time only. Okay, so this means you are having critical thinking. Next, any doubt in these causes?
No, ma'am.
No, ma'am.
Extreme bending, like, okay.
Extreme stretching or extreme bending. In either cases, it will be increased ICP. Okay, now we will talk about sign and symptoms. So these sign and symptoms you can assess in yourself also. From the sign and symptoms, you will get to know we also sometimes get increased ICP, but it's not of that level. You can check here. Altered LOC means level of consciousness. Then the person will be irritable. Irritability. Then restlessness.
Fatigue.
Then drowsy. His or her response will be very slow. The response will be very slow. And the nature of vomiting will be, yes guys?
Projectile.
Yes. It will be projectile and there will be severe headache. Okay. Now,
Ma'am, projectile vomiting, like how?
okay, I will explain you this. If this is the person, he is standing here. If he is vomiting, he will vomit in this pattern.
Okay.
Okay. This is the projectile direction. He will be vomiting in this pattern. You will get to know the person is having increased IC. Okay.
Yes, ma'am.
Now, one thing you need to keep in mind. You can highlight this point if you want to. The very first sign which you will notice is restlessness. This is the very first sign. That person will be restless. Okay.
Yes, ma'am.
Now, there is one thing which you also need to highlight, which is Cushing triad. Cushing triad is found in increased ICP. In this, what happens is increase systolic blood pressure, increased pulse pressure, and decreased heart rate, decreased respiration. So, what is this pulse pressure? What is the meaning of this pulse pressure? Anyone? This pulse pressure means difference between systolic and diastolic blood readings or blood pressure readings. That is known as pulse pressure, their difference. Any doubt in pulse pressure? Any confusion in pulse pressure? Yes. Yes, guys.
So, ma'am, both like systolic and diastolic blood pressure, both are increasing.
What I have written, which pressure will increase?
Systolic.
Tell me. If systolic blood pressure is increasing, but diastolic is not that much increasing, so there will be for sure difference.
Yes. Okay.
Now, okay, let me give you. Systolic and diastolic pressure has difference. That difference is of 40. Our normal pulse pressure is 40. No, 40. Pulse pressure means systolic blood pressure minus diastolic blood pressure. जब हम सिस्टोलिक और डायस्टोलिक ब्लड प्रेशर से माइनस करते हैं उसकी रीडिंग्स को, तो फिर जो आता है उसको कहते हैं पल्स प्रेशर, जो हमारा नॉर्मल होता है कितना 40. अब अगर सिस्टोलिक ब्लड प्रेशर बढ़ गया तो हमारा पल्स प्रेशर में भी इफेक्ट पड़ेगा. क्यों? क्योंकि जो उनका डिफरेंस होगा वो 40 से ज्यादा होगा.
Okay. Yes,
so
ma'am.
that's the concept of pulse pressure. You need to keep this in mind.
Okay, ma'am. Thank you.
Okay? Yeah. So there are few other things which will happen. Let me write it down for you guys. So there will be different type of respiration. So you can write this name. Write it and highlight it. Write it and highlight it. First is kind stroke breathing. Second is ocular nerve compression. Then is doll's eye. Doll's eye is because the brain stem is affected. Then there is fixed, unilateral, dilated pupil, which means the pupil of the patient of increased ICP will be dilated, but in only one eye. The pupil of the patient will be dilated only in one eye, which means unilateral. Okay, done. Any doubt?
Sure. Ma'am,
Yes.
how we like observe or assess like this is the chain stroke breathing or ocular nerve compression and doll size.
Yes. I didn't get your question, what you are trying to ask.
Like if patient is like
she's
chain
asking-
stroke breathing, then how we can assess like he's or she's having this problem?
This is not a normal breathing. Kind stroke breathing is an abnormal breathing. There is difference in breathing patterns. The patient will be first hyperventilating, then there will be apnea. So there is a characteristic of this ICP, that is kind stroke breathing. This is not normal. It doesn't happen in normal people. It happens only when there is increased ICP. That's why I told you to mark it.
Yes.
Okay. You can write it down. First, there will be hyperventilation, then there will apnea. Let me write it down. So, first there is pattern. The pattern is such a way, first there will be hyperventilation, then there will be apnea. In this way, this breathing pattern happens. Okay. Done? You
Yes,
all
ma'am.
have written?
Yes, ma'am.
Fine. Okay, now I will give you 10 minutes break.
Okay.
Okay. First thing is the airway should be patent. Second is the hyperventilation. Reason being, as we have seen in the cause, कि कार्बन डाइऑक्साइड ज्यादा हो जाए उसकी वजह से increased ICP हो सकता है. So for that reason, we will give more oxygen to maintain the level of carbon dioxide. Third thing, which is very important, जब भी आपको whenever you have to suction the patient, that it should be less than 10 seconds. It should not be more than 10 seconds. And और जो ऑक्सीजन होगी वो आपको सक्शन करने से पहले भी देनी है और बाद में भी. You have to first give the oxygen, then you will do suctioning, then again you will give the oxygen. Okay? You can put star or you can highlight accordingly. Then the head of bed should be 30 degree. Then you need to maintain cervical spine
Spine
stability.
stability.
This need to be in proper position. Okay. Third is avoid extension, flexion, rotation of head. हम ये क्यों avoid करेंगे? रीजन बीइंग हमने देखा था कि कॉजेस में इंक्रीज आईसीपी के अगर ज्यादा एक्सटेंशन या फ्लेक्शन हो उसकी वजह से भी इंक्रीज आईसीपी हो सकती है. So to avoid that, we need to avoid extension, flexion and rotation of the head. Okay?
Yes, ma'am.
One more thing, हमने एक और चीज देखी थी cause में. क्या चीज थी वो? That was Valsalva maneuver. So अब Valsalva maneuver से हो सकता है तो क्या हम ये देंगे या नहीं देंगे? Valsalva maneuver आप increased ICP के को दोगे या नहीं दोगे? You will not give this. ये हमने causes में भी लिखा है. You will never give Valsalva maneuver to the patient of increased ICP. Then you can give stool softener. Stool softener हम क्यों देंगे? Because हमने देखा था causes में कि constipation भी एक cause हो सकता है increased ICP का. For that purpose, we will give stool softener. Then avoid hypothermia. You need to maintain normal temperature. So these all are the things which you should keep in your mind. So next, we will talk about medicines, medical management. So first, we will give osmotic diuretics. ऑस्मोटिक डायूरेटिक्स की एक एग्जाम्पल है
Mannitol.
यस वेरी गुड इट इज मैनिटोल. हम पेशेंट को मैनिटोल देंगे बट यू नीड टू कीप वन थिंग इन माइंड. आप मैनिटोल के नीचे इसको हाईलाइट करो. whenever आपको कभी अगर एनक्लेक्स में क्वेश्चन भी आए whenever you will give mannitol you will use filter. You will use filter to avoid crystallization. You will use filter to avoid crystallization. This thing you need to keep in mind. अब एक और चीज है, अगर आप ऑस्मोटिक डायूरेटिक्स दे रहे हो मैनिटोल, अब वो मैनिटोल क्या करता है, ये बॉडी में शुगर को भी बढ़ाएगा. और अगर इफ द पेशेंट इज डायबिटिक, if the patient is diabetic, तब आपको क्या करना है, आपने उसको मैनिटोल के साथ इंसुलिन भी जरूर देनी है. किस कंडीशन में देनी है इंसुलिन? In which condition you
Patient is diabetic.
keep that thing in mind. Only if the patient is diabetic, then only you will give insulin. Fine?
With Manito.
Yeah. Now I will give you side effects of
Ma'am,
manitol.
can you say it again, ma'am, please,
Okay.
regarding the mannitol?
Sure.
Patient is
So now mannitol is a type of osmotic diuretic. Okay. First thing which you need to keep in mind is you need to use filter. The reason being filter will avoid crystallization. Second thing is mannitol increases glucose level or sugar level in the body. And if the patient is diabetic, the condition is if the patient is diabetic, then you will give insulin along with mannitol. This is a very, very important point you need to keep in mind. Is it clear now?
Yes.
Any doubt in this?
No.
No? Okay. Now we will talk about few side effects of mannitol. Mannitol will increase to fluid overload, which could lead to जो जिस ड्रग का भी मैं आपको साइड इफेक्ट बता रही हूँ, यू नीड टू कीप इन माइंड। अभी तक हमने कौन कौन से ड्रग्स के साइड इफेक्ट पढ़े? फर्स्ट वो स्टीरॉइड्स। Yesterday we learned about steroids and its side effects. You have to keep that in mind. And the second was the muscle relaxant. And third is the mannitol. You need to keep this in mind. Hypertension, tachycardia, and crackers. One thing now from here also, if there is crackers, you need to immediately report. If you are hearing crackers, you need to immediately report. It is very important. So now, अब हमने देखा मैनिटोल का साइड इफेक्ट क्या है, वो फ्लूइड को ओवरलोड कर देता है। तो व्हाट यू थिंक, मैनिटोल फिर देना चाहिए या नहीं देना चाहिए? यस, should we give mannitol? There is one catch. We have to give mannitol. हमें ICP को डिक्रीज करना है। अब कैच ये है कि हम उसके साइड इफेक्ट्स को, to deal with the side effects, we give loop diuretics along with mannitol. Loop diuretics such as Lasix or furosemide. This is given with mannitol to decrease fluid overload. So this is very important, very important. To battle with fluid overload, in case of mannitol, we will give loop diuretics. Highlight this point.
Ma'am, can you please repeat this slide?
Sure. This loop diuretics.
Yes, ma'am.
Okay. So now what is in loop diuretics? जैसे हमने बताया कि मैनिटोल का एक साइड इफेक्ट है क्या? फ्लूइड ओवरलोड। ओके, उससे फ्लूइड ओवरलोड हो रहा है जिसकी वजह से टैकीकार्डिया हो रहा है, हाइपरटेंशन हो रहा है। अब हमें उसको तो देना ही है मैनिटोल को, बट हमें उसके साइड इफेक्ट्स को भी मैनेज करना है। अब टू मैनेज इट्स साइड इफेक्ट्स हम उसको लूप डायूरेटिक्स देंगे। क्यों देंगे? अब जो लूप डायूरेटिक्स हो गया जैसे लेसिक या फ्रूसेमाइड, ये हमारी बॉडी में से, जो पेशेंट की बॉडी जिसको हमने मैनिटोल दिया होगा, उसमें फ्लूइड ओवरलोड को कम कर देगा। इन अदर वर्ड्स, जो मैनिटोल के साइड इफेक्ट्स थे उसके साथ लूप डायूरेटिक्स डील कर लेंगे। तो एक बैलेंस मेंटेन हो गया। जो हमें रिजल्ट्स मैनिटोल से चाहिए थे हमें वो भी मिल गए, और जो हमें उसके साइड इफेक्ट्स मिले थे हमने वो भी सप्रेस कर दिए। ओके, so that was all about loop diuretics in case of mannitol. Now, अब हमने मैनिटोल भी दे दिया, लूप डायूरेटिक्स भी दे दे। Now, what we need to keep in mind is we need to monitor input and output chart. अब हम ये चार्ट क्यों मॉनिटर करेंगे? इनपुट एंड आउटपुट। इनपुट एंड आउटपुट चार्ट हम इसलिए मॉनिटर करेंगे कि हमें पता चले, वी गेट टू नो वेदर जो फ्लूइड ओवरलोड की प्रॉब्लम थी वो डील हुई है या नहीं हुई। इसको चेक करने के लिए हम इनपुट और आउटपुट चार्ट मेंटेन करेंगे। गॉट इट? एनी डाउट इन दिस पार्ट?
No, ma'am.
No,
Yes.
ma'am.
Yeah. So now we will have a quick recap. So first tell me if there was any doubt in ICP. Yes. कोई doubt, कोई query in ICP?
Ma'am.
No doubt?
No, ma'am.
Clear?
No, ma'am.
Okay. So now tell me the normal level of ICP.
5 to 15 mm of HG.
Good. Then what are the causes?
Ma'am,
Oral
extreme
infection,
flexion, oral and dry,
infection
extension
and
of neck,
extension of neck,
extreme
extreme
bending,
blending,
Then
and increased abdominal
increased
pressure.
abdominal pressure.
In
Okay,
increased
now,
abdominal pressure, we can see constipation, Valsalva maneuver,
now
or
tell
tight
me one
legs.
thing. Tell me one thing. To deal with this constipation, what you will do?
We will give the
Stool smoothing.
Yes.
stool softener to the patient.
And to deal with this thing, what we need to do? The timing will be less than 10 seconds.
10
Less
seconds.
than 10 seconds,
Less than
and
10
we will hyperventilate the patient before and after.
And what about these things? We need to avoid extreme flexion and extension.
Extension of the neck.
Now,
And
next.
rotation of head.
Now we will talk about sign and symptoms. What all will be the sign and symptoms? Altered
Level of consciousness,
irritability,
restlessness, drowsy,
drowsy,
restlessness, drowsy,
headache.
low responsiveness, vomiting, projective,
Vomiting, projection,
severe headache.
severe headache.
What will
And
be the,
vomiting is projectile.
and the first sign which you will see in ICD patient will be
Restlessness.
Restlessness.
good. Now, this is the Cushing triad. So the systolic pressure will decrease or increase?
increase, pulse increase,
Pulse
heart rate
pressure.
and respiratory
Wait.
increase.
Pulse will not increase. Pulse pressure
Pulse
will increase.
pressure will increase.
Pulse pressure. And
Decrease.
what is pulse pressure?
Difference between
Difference
systolic
between
and
systolic
diastolic.
and diastolic
Systolic
BP.
pressure minus diastolic pressure.
Then what is Kind-Stokes breathing? What will be the pattern?
Hyperventilation and apnea.
Hyperventilation or apnea.
First, there will be hyperventilation, then apnea.
Then apnea.
Hyperventilation, apnea. Then ocular nerve compression, doll's eye. Doll's eye, the cause of doll's eye is brainstem.
Brainstem affected.
Whenever brainstem is affected, there will be this symptom doll's eye. Then one more symptom is there, fixed unilateral dilation, which means only one
eye dilated.
One pupil is dilated.
Then
Nursing intervention.
airway will be, what you will check? Patency. Then hyperventilation, suction less than 10 seconds. Then what will be the bed?
30 degree.
Okay. And what all? You won't be giving Valsalva maneuvers, stool softener. You will give, and you will avoid hypothermia.
Normal temperature.
Which osmotic diuretic you give?
Mannitol.
Mannitol. And what you will use?
Filter.
Why we will use filter?
Filter
To avoid
crystallization.
Yes, to avoid crystallization. Then, now,
in case patient is diabetic,
we will give insulin.
we will give the insulin.
Added insulin.
With the mannitol.
Yes. Next, what are the side effects of mannitol?
Increased
Fluid
fluid
overload. In that, it will happen hypertension, tachycardia, and crackles.
And what
If
you will,
crackles is there, immediately we have to need to report to the physician.
yes. And to tackle this, what we give?
Loop diuretic. Lastic or prosamide.
Mannitol plus loop diuretic.
Yes. And what is the purpose of loop diuretics?
To decrease the fluid overload.
The fluid overload.
Good, very good. So that means this ICP is clear. Any doubt in ICP you are having? Any doubt in the meningitis disease? These two diseases are clear, right?
Yes.
Then we will continue with our next topic. So first let me tell you one thing. Neurological disorders, they are very, very important. Very, very important. You will for sure get case studies from these topics. So the drugs should be on your point. You should have memorized the drugs, the side effects, and you should know the sign and symptoms. Because what happens is, अभी आप पढ़ रहे हो ना, तो अभी आपको you won't be facing any issues. But after 2-3 days, you will get confused. So for that, you need to keep in mind to revise. Revision is must. Okay.
Yes, ma'am.
Now, we are moving towards our next topic. Our next topic will be Guillain-Barré
Guillain-Barré syndrome.
So now tell me one thing. Multiple sclerosis was a central nervous system disorder or peripheral nervous system disorder? बताओ.
Central nervous
Nervous
system.
system.
Central nervous system.
Very, very good. But this disease, write down in your notebooks and highlight it. This disease is peripheral nervous system disorder. So there will be demyelination of peripheral nerves. There is acute onset. And that is due to infection of nervous system. Here, in Guillain-Barré syndrome, you will find in patient history of upper respiratory tract infection, GI infection, that will be more than or 2 weeks. So the causative agent is Epstein-Barr virus.
Ma'am, I haven't tried history. Can you show me? Done, ma'am.
You all have written?
Yes, ma'am.
So the causative agent is Epstein-Barr virus. This is the causative agent. Yes. And there is no cure. There is no cure for this disease. Now, tell me one thing. In multiple sclerosis, the order was ascending or descending?
Descending.
Descending, ma'am.
Are you sure?
Yes, ma'am.
Yes, ma'am.
Good.
Descending to ascending.
Very good. But here, the order will be ascending order. The weakness will be in ascending order, which means the weakness will be from lower part to upper part. The weakness will be from the lower to upper.
Lower limb to upper limb. Right.
Yes. Then there will be paralysis.
Flaccid.
What is the meaning of flaccid paralysis? It means there will be no spasm. Spasms are not there, but weakness is there. Spasms are not there, but weakness is there. That means flaccid paralysis. Okay. Then there will be tingling. Then there will be numbness. Dyspnea. Inability to cough. Dysphagia. What is the meaning of dysphagia?
Or difficulty in swallowing.
Yes, dysphagia means difficulty in swallowing. Okay. Then there is dysarthria. So bowel and bladder dysfunction was also in multiple sclerosis. Am I right?
Well, dysarthria is difficulty.
Movement, joints. In your joints there will be problem. So dysarthria and bowel and bladder dysfunction was also present in multiple sclerosis, and these two are also present in Guillain-Barré. So there will be few symptoms which will be common, and the other will be different. Then there will be quadriplegia. Quadriplegia means it affects the ability, you can write it affects the ability to voluntarily move the upper and lower body. Then there will be paresthesia, which means there will be tingling, burning sensations, pins and needle sensations, that are paresthesia. But there is one thing. So now tell me, in ICP, what was the one thing which you must report? कौन सी चीज थी उसमें कि जो जब होती थी हमें रिपोर्ट करना होता? यस बताओ. Crackles.
Crackles. If patient is having crackles.
Good. अब इसमें क्या होगा जब भी shallow respiration होगी? Whenever there is shallow respiration, you need to report. Whenever there is shallow respiration, you need to report. So here, now I will explain you what it means. Shallow respiration means when the patient take in less air with each breath. So why you need to report shallow respiration? What is the cause? Why we have to report it? Because if there is
No,
shallow respiration, that means there is paralysis in the muscles.
Lung muscles.
Yes. So it could be fatal. So that's the reason we need to report. There are few other things which you need to report. You need to report. You need to report cough. You need to report dyspnea. And you need to report shortness of breath. These three things you have to keep in mind in this disorder. Whenever these three things are there, you need to report. This is of utmost importance. Then the diagnosis will be lumbar puncture only. Now tell me, lumbar puncture में हमने. Now you will tell me what all were there in lumbar puncture. Come on, one by one. First, the level was like where we need to insert the needle. In which
L3 and L4.
Level 3 and 4.
in
One position we can give lateral
no,
decubitus.
wait. Level 3, then the space was
Subarachnoid space.
subarachnoid space. Then what else was there? During the procedure, क्या हम देंगे position? During the procedure.
Lateral decubitus.
Lateral decubitus.
और उसके बाद
Lateral position. Supine. Fine.
क्या instructions देंगे हम? What all instructions we will give?
To avoid before the procedure. And
And after the procedure,
Fine position.
fluid.
increase the fluid intake.
Increase the
Increase the
patient.
fluid intake.
That is very, very important that the patient should increase the fluid intake. Fine?
The
Any
next
other thing?
procedure is sterile procedure.
Sorry, Govindraj, what you are saying?
Yeah, procedure doing this sterile procedure.
Sterile.
Yeah, it's a sterile.
Yeah.
Good.
Sterile.
It was all about the lumbar puncture. Now, what you need to do, what is the nursing interventions? Respiratory support. You need to keep this in mind. No muscle relaxant. No live vaccine. Now, हमने live vaccine कुछ मैंने आपको लिखवाई थी.
HIV.
मैंने आपको कुछ नाम बतवाए थे. क्या क्या थे बताओ? BCG और कौन कौन से थे?
HPV.
टुमारो कल के लेक्चर में सबको लाइव वैक्सीन का पता होना चाहिए जो मैंने कल करवाया था. इट इज वेरी इंपॉर्टेंट. You should know the names of live vaccines. Okay.
Mums.
BCG, MMR, ORV.
Yes. Then IV,
Flu
IG,
shot, nasal spray.
very good. Then plasmapheresis. So these two things. So there is one thing. There could be one complication. That could be DVT, deep vein thrombosis. There could be chance of blood clot.
Ma'am, what is this IV, IG and plasma?
Plasmapheresis, it is a procedure. It is a procedure in which the antibodies are removed from the blood. Okay, I will write the form. Immunoglobulin treatment. And then plasmapheresis. It removes this one. Plasmapheresis, it removes antibodies from the body. Any doubt till now?
No, ma'am, that's okay. I have a question, ma'am. There is another connect disease bar syndrome, Guilin-Barre syndrome. It is, I think, Miller-Fisher bar syndrome. Can you explain Miller-Fisher bar syndrome? What is difference between GBS and Miller-Fisher?
Currently, we are talking about GBS.
Okay.
Okay, so
but it is also, I think, connected with the
don't worry,
GBS.
you just need to focus on GBS.
Okay.
Okay, what happens is when you are getting extra knowledge, you just need the knowledge which is relevant to your NCLEX. Because
I think it is a similar with the GBS. That's why I asked you.
Currently, you just need to learn about GBS only. We are discussing about GBS only. And if you have any questions related to this topic, then you can ask. Because that's the subtype and that's not of any relevance in your part. Miller-Fisher, that is something which is quite deep. In it, there happens areflexia.
I think in that we are also doing plasmapheresis in these two diseases.
That disease is a subtype of this disease. There areflexia happens, ataxia happens, then there is ophthalmoplegia. But you don't need to go to that side. You only
because which time I was in a dialysis unit, and that time we are also doing plasmapheresis, Miller-Fisher and GBS. We are both of you are dealing.
So that is your practical thing. That is something you are doing in hospital. But here we are learning about NCLEX topics. So the one Miller-Fisher is not of that much importance because that is the subtype of GBS. That is a further type of GBS. We have 3 to 4 different types here. So you don't have to go that much deep. Okay, only focus on these topics.
Ma'am, you mute yourself.
So any doubt, any queries till GBS?
No, ma'am.
Clear with GBS?
Yes.
Yes, ma'am.
Okay, good. So now,
ma'am?
Yeah.
In nursing intervention, we just do respiration support
Yes.
or no muscle relaxant and no live exit.
So yes, and one more thing in nursing you need to keep in mind, which is you need to report few symptoms. You need to keep in mind if there is shortness of breath. Okay. So these are few things which you keep in mind. If there is cough, the patient is coughing. If there is dyspnea, there is shortness of breath, immediately you got to report. Okay, this is very. So these are the things which you need to keep in mind. Okay. Now we will talk about once.
Can we recap, ma'am?
You want a quick recap?
Yeah.
So first, what is GBS?
Guillain-Barré syndrome.
Good. It is the central one or the other one?
Peripheral nervous system.
System.
There is demyelination of peripheral
The
nervous.
peripheral nervous system.
Then what is the cause? Epstein-Barr.
Epstein-Barr virus. And there
There-
is no cure.
There is no cure. And the sign and symptoms are, come on,
Ascending weakness.
Ascending
Ascending, like
weakness. Then
Also,
paresthesia, tingling,
tingling, numbness,
then
dyspnea.
paralysis, flash.
paralysis, then but the paralysis of which nature? What will be the nature? The nature will be
Flaccid.
placid.
Flaccid paralysis.
No spasm but weakness present.
Yes. Then what else?
Numbness,
Inability to cough.
Yeah. And what else?
Dyspnea.
dysphagia, dysarthritis.
Dysphagia.
Dys- what is the meaning of dysphagia?
Difficulty in swallowing.
Difficulty in swallowing.
Very good. What else?
Dysarthria.
Yes.
Bowel and bladder dysfunction.
Yes. Now tell me
Quadriplegia.
one thing.
Quadriplegia.
Now these two were present in which disease?
Multiple sclerosis.
Very good. These two were there also. Okay. Then what else? Then what is the diagnosis?
LP.
Lumbar puncture.
Lumbar puncture.
And what? Okay. Now I will ask you. During the procedure, what position?
Lateral.
Pubertus.
And the space will be subarachnoid.
Subarachnoid space.
L3
Space.
Then what will be the position after?
Supine.
Supine.
Supine
And
position.
what will be the teachings?
Increase the fluid.
Before procedure, avoid
Increase fluid intake.
Mm-hmm.
Isotonics.
And what things you will report?
Cracker.
and difficult
Shortness of
Has to
breath.
be.
These are the things which you will report. Okay. And then the management will be of
IVIG, immunoglobulin treatment, and plasmapheresis.
Plasmapheresis.
and what will be your no live vaccine?
Yes.
No
And no
live-
muscle
No.
No muscle relaxant.
no muscle relax. And there could be
Respiratory
chance
support.
of DVT. There could be a
DVT.
chance of DVT.
DVT and blood
That
flow.
is all about GBS.
Thank you, ma'am.
Okay. So
Okay.
now tell me what the first topic we studied today.
Meningitis.
Meningitis.
Yes. And the meningitis could be of bacterial, viral, fungal, any nature.
Yes.
And two main sign and symptoms. Two main. One is Kernig's and other one is
Bruising sign.
the knee
Bruising
one
sign.
is involved in which sign?
Turning sign.
Curling
Turning
sign.
Please turn on your cameras. All of you turn on your cameras. Yes, Rosaline. Emmanuel. Yeah. Bhavna, turn on your camera.
Yes, ma'am.
Emmanuel, please sit properly.
Okay.
Yeah. Sit properly. Yes. So in meningitis, we have two signs important. One is Kernig's and the other one is?
Bruising sign.
Yes, good. And knee is involved in which sign?
Curling sign.
Turning sign.
And the diagnosis will be?
Lumbar puncture.
Lumbar puncture.
And in lumbar puncture, you should never forget. Points. Point number 1.
L3,
L3 and L4
And the
sterile procedure.
and position lateral
position is lateral decubitus and it is a
Before,
sterile
yeah.
procedure and we
Subarachnoid
should
space.
instruct the patient to void before the procedure.
Very good. And
And
one more thing.
after the procedure, we
After
can
the
give
position.
supine position
Spine
What about
position
fluid?
also we give
and increase
isotonics.
fluid intake.
Increased fluid intake.
Good. And then the other topic was?
Intracranial pressure.
Intracranial pressure.
Okay, now one by one I'll ask. Rupa, please tell me the normal range of ICP.
5 to 15, ma'am.
And what are the causes?
Oral and trachea suctioning,
Hmm.
extension and
Mhm.
flexion of the neck
Extension,
and
flexion.
bending and
Mhm.
abdominal
Extend,
pressure.
yeah.
And what are the signs and symptoms?
Altered
Uh,
LOC,
Yes.
irritability,
Irritability,
restlessness, drowsiness,
low
slow
response,
response,
Hmm.
vomiting,
severe
projecting,
headache.
Yes.
severe headache.
And what else?
The
The first sign.
first sign is restlessness. Restlessness.
And how you are going to manage the ICP patient? Nursing interventions.
Yeah,
Airway,
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 hyperventilation,
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 suction
suction
less
is
than 10
less than
seconds,
30
seconds,
seconds,
oxygen before and
oxygen
after.
before and after,
oxygen before and
head elevation 30 degree,
Mm-hmm.
cervical spine is
And what else?
stabilizing, avoid
Avoid
extension and deflection,
extension, flexion,
rotation
and
of the head.
rotation of head.
What about medical management? What all drugs you will be giving?
We should give osmotic diuretics.
The Kavaljeet.
mannitol. Mannitol, we can use the filter.
Yeah, and Kavaljeet,
For
please
crystallis.
tell us the side
Yes,
effects
ma'am.
of mannitol. Side effects of mannitol.
Fluid overload, ma'am.
Very good. Or what we
Fluid
can
overload, ma'am.
and what we will give in that condition?
Loop
We will
diuretic
give
with
with the
mannitol.
Loop diuretics we have to
with
give.
the mannitol, so the fluid overload should be decreased.
Now, tell me one thing. How you will get to know that there is fluid overload in the body?
Monitoring intake and output.
Intake
No,
output
Yes.
chart.
What are the signs of fluid overload? There are 3 signs.
Respiratory distress.
Shortness of breath.
What?
Shortness of breath, ma'am, first thing.
Hypertension, tachycardia, crackles.
Yes, yes. High.
Crackles.
3 signs, ma'am.
In
You
case
told.
patient feel crackles, immediately report to healthcare provider.
Very good.
Yes.
And the third topic was
The topic Guillain-Barré syndrome.
GBS.
now it is a central nervous system disorder or the peripheral?
Peripheral nervous disorder.
Nervous system disorder.
And what happens in this disorder?
Acute onset
Upper and lower
infection.
limb weakness.
Acute onset due
Demyelination.
to infection of central nervous system.
And what is the causative agent?
Ma'am, Epstein-Barr virus.
Very good.
And there is no cure.
It's not curable.
Yeah, it's not curable. And its pattern of weakness will be in which format? Ascending or descending?
Ascending.
Ascending.
Ascending, ma'am.
And what is the meaning of ascending?
Lower to upper.
Weakness will be
upper.
lower to upper.
The weakness will be lower to upper limb.
Very good. And what all we can do? Now you tell me what you will report in GBS.
The 3 signs
Dyspnea, cough, shortness of
and
breath.
SOB.
Okay, now if there is question,
Cough,
there is
dyspnea, and
there is one
SOB.
question. There is patient with GBS. He is coughing, having shortness of breath, and there are 4 options given. Okay. First option is you will do suctioning. Second is you will give oxygen. Third is you will report. Which option you will select?
Yes.
Report.
Now you got how you will implement your knowledge.
Yes.
आपको समझ आया how you will implement this knowledge. In this way,
Yes,
there will be
Yes.
tricky questions. You just need to keep in mind what all things are of importance. जो भी मैंने आपको highlight करवाया, mark करवाया, that should be in on your tips. वो कभी भी मैं आपसे पूछूं किसी भी टॉपिक में किसी भी लेक्चर में you should know. जैसे मैंने आपको बताया था live vaccine का, but आपको you are not aware of the live vaccine. That's not a good. If I am putting efforts, then I expect from your side as well.
Sure.
So now tell me what we avoid in GPS. Yes, Rupa will tell me. Rupa, what we avoid in GBS?
Vaccine.
Yes.
No,
Which vaccine?
no, live
Live
vaccine.
vaccine.
Live vaccine.
So
No
do,
That is
muscle
most
relaxant.
important.
do you know why we avoid live
Muscle
vaccine?
relaxant, no live vaccines.
Because it will activate immune system.
Because
Okay, because already the person is
Yeah.
suffering from that disorder. So that's the reason in autoimmune disorders, in these disorders, in multiple sclerosis also, we will not give live vaccine. Okay, so that was all about today class. Now you tell me if you have any doubt in these three topics.
And then there could be a chance of DVT as well.
Yeah. That's the chance of DVT because there could be any blood. Now you tell me if you have any doubt.
No,
Any
ma'am. It was great
Okay.
session.
So now we all will clear NCLEX really fast, right? फटाफट हम
Yes,
सब
ma'am.
एग्जाम को क्लियर कर देंगे in this way. Fine. Okay, so we will meet tomorrow again at 6:30 sharp. इस बार रिवाइज करके आना. I will ask questions tomorrow. Okay? कल
Yes,
का
ma'am.
टॉपिक भी और आज का टॉपिक भी. Okay, bye bye. Take care.
Okay, bye.
Thank you,
Thank you.
Thank you, ma'am.